There is a dangerous disease that usually spikes around this time, and we're not talking about COVID, but this disease is extremely
The
contagious.
American Lung Association is behind a nationwide effort to get the word out about pertussis, or whooping cough. Doctors say it's a disease that not only hits babies especially hard, it also impacts millions of adults as well.
It can lead to uncontrollable, violent coughing, making it hard to breathe. Our Sally Hernandez sat down with a lung specialist for a deeper look.
As a physician and expert in this field, I'm sure you see many patients who have come down with COVID and what that does to their lungs. Are you still seeing people though who are getting pertussis that could have been prevented?
And that's what's key here, right? We want to help every human being, but in the back of our minds, when we know we could have prevented an illness, any illness, it always bothers us, right? Because that means we could have done better to get out there and promote the messaging. And every patient I've cared for who's developed pertussis, whooping cough, will tell you that they're like, I wish there was a way I never had it, because that cough in of itself, it's rib breaking. Right? And it can last for quite some time, even after the infection has gone away. Now, the vaccine that is available is Tdap. It's been around since 2005, and it's one that's incredibly underutilized. About 33% of Americans received it over the last decade.
What's your call to action here? Are you asking people who have lung issues or asthma to get this vaccine, or a certain age group to do it?
So the first thing is just attention. Right? We have another infection that's been around far longer than COVID. The second call to action is talk to your healthcare professional, especially if you have an underlying lung condition. And you know who you are, right? You carry that inhaler in your purse, in your book bag all the time. So from that standpoint, that's the messaging here. We want to promote that information. And if the vaccine is appropriate for you, get it.
Doctor, thank you for starting that conversation with us.
Thank you for allowing us to promote health.
Here is a look at the recommended times to get those vaccines. According to the CDC, babies should get 3 doses of the DTaP vaccine. Children should get a booster between 15 and 18 months and a second booster between ages 4 and 6. A different vaccine called Tdap is for older people, kids around age 7. The CDC recommends 1 shot for children between 11 and 12 years old. Adults should get a dose of the vaccine every 10 years.